Looking back on that day feels more like a nightmare. The first thing I did is let the receptionist know I was having difficulty breathing due to anxiety, and if there was a place I could sit and take my mask off. The receptionist said that I could sit in the lobby with my mask off and that she would ask the doctor about making accommodations. I said thank you and sat down. When the nurse called me in, I put my mask on until I got into the exam room. When we got into the room, I asked the nurse if I could take my mask off and she said no. I said, but I'm having breathing issues. And she said it doesn't matter, you have to keep your mask on. Out of desperation to breathe, I told her she could leave the room so I could take my mask off. She seemed annoyed, rolled her eyes, and let the door slam behind her. The door was metal and the slam was loud. A moment later, the doctor stormed in with his hands on his hips and said, I hear you're giving my nurse a bad time. I tried explaining to him I was having breathing issues, but he continued to chastise me for being rude to his nurse, and when he was done, then he asked me, what can I do for you? I explained to him I had a ruptured cyst and that I needed antibiotics. With his hands still on his hips, he said, well, roll over then and let's take a look. Because of his unprofessional attitude and still having an angry disposition, I told him he had no compassion and I left the room. He writes a fiery and grossly inaccurate statement in his records. I never refused to wear my mask, I never screamed at staff, I never stated my throat was closing up, I was never agitated, I was never non-compliant with staff, nor was I sent to ED by wheelchair, thank you. There's not a member, staff member, employee, surveillance video that could support any of his comments, and me and my wife walked to emergency department for antibiotics and treatment for a cyst. I can only imagine what Dr. Burns communicated to the emergency department, because when I got to the emergency department, they quarantined me for altered mental status and told my wife I had a serious brain infection. All based off Dr. Burns' disgruntled comments. I spent only 2 or 3 minutes with Dr. Burns, and he spent the entire time chastising me. When did he have time to make any serious assessment for altered mental status? I had absolutely zero symptoms. My blood work came back unremarkable, and take note, specifically my white blood count was in normal range at 9.6. I was subjected to 3-day quarantine, needless chest x-rays, CT scans, and a multi-level puncture spinal tap that left me crippled with nerve damage. A PubMed article published January of 2021 reads as follows. Risk of invertebral disc joint puncture during lumbar puncture. Penetration of the invertebral disc joint during lumbar puncture might be unnoticed during procedure. However, accelerated degeneration of the disc is a long-term consequence of inadvertent penetration. In this paper, we aim to demonstrate and evaluate the risk of disc puncture during standard lumbar puncture. 50 human cadavers were used in this study. Disc puncture was assessed by using worst-case scenario model. Lumbar puncture was performed in a standard fashion using midline route at L3-4, L4-5, and L5-S1 levels. Needle was advanced until it hit resistance from the bone. Lateral X-ray was used to visualize the needle position. Needle ended up in 2 possible locations: posterior vertebral body wall and invertebral disc space. The probability of puncturing the joint was 20% for the L3-4. 38% for the L4-5, and 16% for the L5-S1. Total probability of disc penetration was 25%. Statistical analysis revealed significantly increased risk for performing LP at the L4-5 level comparison with the L5-S1. Conclusion: lumbar puncture carries significant risk of invertebral disc penetration. The complication is not realized during the procedure and lead to accelerated joint degeneration. According to the ER doctor, they made more than 5 attempts to the L4-5 before accessing space with the quinky-tip traumatic needle, a blunted needle that causes more trauma than the standard atraumatic needle that causes far less damage. However, this doctor's statement is not true. The ER doctor attempted at least 3 times in the L3-4 disc space, as I complained several times that I feel it in my hip. Before he said, sorry, let me try a little lower. 1 second later, as soon as he punctured the L4-5 disc space, I screamed very loudly and my leg jumped off the chair it was resting on. The doctor began to panic and said he had to go get the anesthesiologist. The nurse turned to me and said,
I don't know what happened. He's usually pretty good at this.
When the anesthesiologist entered the room, he said to the ER doctor standing behind me,
What's this?
It's a pediatric kit. We are all out of adult kits.
Yeah. Where's the medicine?
I have to go to the pharmacy to get it.
While the doctor retrieved the medicine, the anesthesiologist was pacing back and forth, coming in and out of the room, and said to me,
I don't know what happened, but you're not going to feel a thing when I do it.
The ER doctor came back with the medicine, and the anesthesiologist walked me through the procedure as he was doing it and punctured the L5-S1 disc space, and the pain was minimal until the next day. Smoking gun. Prior to the lumbar puncture at 4:05 p.m., my blood work showed my white blood count was normal, in range at 9.6. However, after the lumbar puncture, my white blood count elevated to 13, indicating infection, inflammation, or stress. After my lumbar punctures, my CSF fluid results were unremarkable with the exception to CSF protein, which was extremely elevated to 120, indicating nerve damage or other issues in the central nervous system. These extremely elevated numbers were suppressed and never discussed with me, proving collusion to conceal medical information and proper treatment for my spinal tap injuries, and exposes the lack of integrity and how commonplace it must be at Kaiser Permanente. There was no urgency, I had zero symptoms, I was in no danger, I was quarantined and posed no risk to others. They could have waited out the 3 days, but they didn't. They pushed the lumbar puncture and lied to my wife and told her I had meningitis. That was a serious breach in healthcare protocols and expectation of service. I had no other explanation to why I was admitted for altered mental status except for Dr. Burgess's behavior and comments. I know this because the ER doctor asked me what happened at minor illness and injury department, and I told him. Doctor makes note that he doesn't even know what to make of the altered mental status because I was never agitated and because the story from Dr. Burgess was bogus. He also notes that he would put off the lumbar puncture unless I become agitated. I never became agitated, but for no good enough reason, they pushed the lumbar puncture with no urgency and no ultrasound guidance anyway. I told everybody about my lumbar puncture and my pain, but they kept telling me to take over-the-counter meds and it would go away, but it didn't. I finally got an MRI. The radiologist makes note the lumbar spinal canal is somewhat diffusely small, perhaps developmental, secondary to short pedicles. I was that worst case model. The exact reason the article was published, the exact reason why ultrasound guidance should be mandatory with every lumbar puncture and any injection near a nerve. I saw 2 spine specialists at Kaiser and they were both disingenuous. Both said the lumbar puncture could not have caused my injuries. One even stated that if it really happened, I'd be paralyzed. It was pretty close. One liar after another, all seemingly covering up for the other, I filed an official complaint and this was their response. The chief explained that a lumbar puncture procedure would not cause the issues noted in your MRI. Any cord injury caused by the lumbar puncture procedure are evident at the time of the procedure. However, there is no documentation that you were experiencing back pain at the time of the procedure or during your ED visit. So I was at a dead end. My only option was arbitration. Like most people, I can't afford a $50,000 retainer for a medical expert to fight medical malpractice. And trying to find a lawyer that wants to fight Kaiser or actually help someone who hasn't lost a limb or worse, I gave Kaiser every opportunity to do what is right, but they declined. I provided an overwhelming abundance of circumstantial evidence and their own lab work indicating nerve damage at the time of the procedure, and they collectively kicked me out the door. From my personal doctor to the chief physician in command, all lied, all conspired to protect themselves without once ever considering my well-being. That's Kaiser Permanente. That's how they thrive. I applied for Social Security and was approved. The doctor ran me through some tests and asked me what happened to my back. I said a spinal tap. He didn't say another word.